Hi, this is Pamela Worth with the Hello Health Moms Empowered podcast. Today I have Marley Brodsky. She is CEO of MedCompanion, which is a fantastic healthcare assistant and advocate for busy moms and busy uh, family members as they're trying to care for themselves, their loved ones, both older and younger. So welcome, Marley.
Thank you. Thank you so much for having me.
So tell us a little bit about how you got into this, and then tell us a little bit about how it helps busy family members take care of other family members.
Yeah, so I would say that I initially started this journey after experiencing the complexities and difficulties of the healthcare system myself. I had an 85-year-old grandmother who was battling breast cancer. And through that diagnosis, I saw her go from diagnosis to passing within the first 3 months of her diagnosis. And as I was working with her through that journey, I realized how complicated it is for one person to keep up with all of the new doctor appointments, new medications, new studies, biopsies, lab work that come with having a chronic condition or having a diagnosis such as cancer. And also just having to keep their family informed so that they know how to care for them. So in that struggle, I was grieving and looking for a solution. I wanted to see if there were things that offered this type of support to patients. And one of the things that I noticed was the most challenging was just getting the information secondhand from my grandmother, trying to understand, like, okay, but what did your doctor tell you? She's like, well, he said something about my breast and this other appointment or this other medication. And I'm thinking, like, okay, I really wish I could have just been there somehow to understand what was going on. So that is why we developed MedCompanion, and our app was to provide a virtual presence when nobody else is really available. So if you have a loved one or even yourself going to the doctor, we want to make it less stressful and less scary. And know that even if you're zoning out, even if you were just diagnosed with something life-changing and you don't capture everything, there is still somebody there that's able to ask questions on your behalf, that's taking notes for you, and after the fact is able to help you manage your care plan.
No, that's fantastic. Now, does the app also allow for people to find a practitioner, or is it solely for note taking and compiling information?
Yeah, so the app pretty much puts a human and brings back a care aspect into healthcare. So while everything is done through our app and we're leveraging technology, we still have nurses, health educators, and medical assistants on the back end. So when you connect with our app, you're accessing a real human on the other side. And whatever your needs are, if you're like, hey, I need to find a psychologist, I need to find a new gastroenterology, or I'm traveling and I am really sick, I need to go to the emergency room, which ones are the best ones in the area? Our team would do that for you, do all the research, and within a few minutes send you the information you need.
So it's almost like having your own medical concierge too.
Absolutely, yes. So that is exactly what we want, is we want to be the go-to for all of your medical needs and provide that for you.
Is there anything that is out of scope that you can't find or do?
Yeah, so things that we can do. We work directly with whatever care plan your doctor provides. So we will never give you medical advice. We will also not give you our own religious or medical opinions. So I believe in vaccines, but I know a lot of people don't, and I do work with a lot of patients who don't. But I don't push that on them. I am like, okay, absolutely. If that is something that's important to you, we'll make sure your physician knows, or whatever it is. We make sure that we're not pushing our own religious or medical beliefs into other people. We respect whatever decisions they want to move forward with.
And then talk to us a little bit about when someone is using the app. Um, does it have like a transcription, almost like a like it's listening and taking notes? Do you have the ability as like the major caregiver of a family to have multiple profiles for kids, parents, taking care of
Yeah,
the entire
absolutely.
family?
Yeah, so the app itself is not the one transcribing anything. The app is a tool that allows you to connect with your human med companion virtually. So anytime you go in there, you have the ability to send a text message, and it is fully protected through the app. And that is how you reach your med companion. You have access to them 24/7. So even if your designated med companion is not available during that time, there is still somebody that is and can help you with whatever your situation is. All of your documentation, all of the like summary of cares that we write with your action steps of like, here's what your doctor wants you to do. Here's where you need to go next. We make it very easy to follow, and
Mhm.
we house everything in the app. So any previous health records, we keep it there. If you were seen in the emergency room and you are now going to the gastroenterologist, we have your ER records already available so that we can send to your doctor, or you can pull it up on the phone through the app and show your doctor. So that is fully available. We also wanted a way that patients felt empowered to track some of those metrics. So if they need to document their blood pressure, they can do that directly on our app, and it creates this beautiful graph over time of what your blood pressure looks like. And then it allows us to send it to your doctor, to your cardiologist. Like, hey, here's Pamela's blood pressure for the last month. She's going to see you next week. So here you go. So they have that ahead of time. They can also record their hemoglobin A1C. It integrates with Apple Watches and Fitbits and a few other things so that it all lives in that app.
How long have you been doing this?
So we started 4 years ago, 2021. We spent the first 2.5 years doing a beta program where we worked with the different patients, different ages, and really stress test our product. And from that, we've been able to perfect the product and work with our developers to ensure that all of the functionalities and securities are in place. And we just launched publicly earlier this year.
And so obviously this is HIPAA compliant. Uh,
100%.
yeah, which is good. Uh, a lot of people, when they hear about these types of things, they figure it's only cash pay, but I understand that you also will work with insurance,
That's correct. We work with Medicare patients.
which is
Yes.
great. Any
Yeah.
plans to work with other insurance companies or?
We hope so. That's our goal. I'm hoping in 2025 that is an area that we can continue to expand into. We'd love to be able to work with other insurance payers and their patients to make sure that patients are able to understand their health. The most important thing for us is when a patient understands their health, they are engaged and they make better health decisions and have better outcomes.
Yeah, we recently did a survey and we asked people where they get most of their health information. Well, first we asked if they find that health and wellness is confusing, and the answer was yes on all of them. Second,
Yes.
the question was where do you find most of your health and wellness information? And most people said Google, Reddit, and YouTube, which is fine. I mean, I would have thought there would have been more like PubMeds and other things out there, but I think people are looking for simple explanations around diagnoses, around symptoms.
Yeah.
Uh, so tell us a little bit about how you're communicating with people when they have questions. Is it based on the practitioner's experience? Is it based on other research that they really rely on?
Yeah, so it's mostly when we are virtually on the patient's phone through the app in the room with them, it's we become a part of that conversation.
Mhm.
So some patients will place their phone on the counter so we can listen. We also have doctors that hold the patient's phone, so they're talking to us as they're talking to the patient.
Mhm.
And ultimately, we are asking questions on their behalf. So sometimes if we notice like a patient forgets to ask about their medication. So we talk to the patients ahead of time and we say, what is one thing that you really want to make sure you get out of this next visit with your doctor? And they'll say, oh, my medication is not working for me and I need a new adjustment or I need a new one. So when they're there, if we see that they forget, we will prompt that question. And we would say, oh, Dr. Smith, your patient, Pamela, was concerned that her high blood pressure medication is not working. She would like to see if maybe the dosage needs to change or if she needs a new medication. And that prompts the doctor to ask more questions. It prompts the doctor to look into other options. And then we are able to then document that. And after the visit, if things change, if new medications happen, it's our responsibility to work with the patient and make sure they understand. And we say, like, your doctor wanted you to take this medication 30 minutes before you have your breakfast in the morning and also 30 minutes before bed. And we have the patients repeat that to us, like, okay, so how are we going to take the medication? Other things that we do, and something that our patients really enjoy in terms of the engagement, is that they tend to ask us a lot of questions, and they want us to simplify. So something that a patient recently said was, I go to my doctor all the time for my high blood pressure, and they always tell me I need to exercise and eat better, but nobody is telling me like how I can start exercising. I've never exercised in my life, or I've never been mobile, and others also say things like, well, I don't even know what having a lower sodium diet looks like. So that is where our med companions and health coaches come in, and they're like, okay, well, let's talk about getting you to a 30 minutes a day. Where can we start? And we're like, okay, what do you do every day? Oh, you walk your dog. That's fantastic. Why don't you start walking your dog for 10 minutes for this week, every single day? And we'll work from there. And then that gives them baby steps to accomplish their goal. And the same thing with their diet. Like, okay, well, let's talk about the DASH diet, which is a really common hypertension diet. Let's talk about the things you should have. Let's talk about the vegetables you should look into. And while we're not necessarily like nutritionists or anything like that, those are just the health education components that are very simple and easy for patients to understand.
That's fantastic. Is there anything else that I have forgotten to ask about, or you really want to make sure that we touch on? Any upcoming functionality that you're super excited about? Anything at all?
Yeah, so something that I'm really excited about was that we have recently grown our team. I now have nurses on my team, which was not something we had 3 months ago. So we're hoping to be able to provide a more customized concierge component. And we are launching that whole new service line with more value added starting November 1st. So for patients who are busy professionals, have families, they want to optimize their insurances because most of them just leave money on the table. They have all these amazing insurances. They don't take advantage of their annual wellness visits. They're not doing preventive care. So we want to make sure we're helping those patients and families optimize their insurance as well.
Well, that's great. I think a lot of people listening will probably be thinking this sounds too good to be true, too expensive. But tell us a little bit about the pricing.
Yeah, so the pricing for our concierge service starts at $2,500 for the year. If you want to add an elderly parent or another adult as a secondary person, then the price is an additional $1,000. And then for children under 18, it's $500. So they're still getting the full service, but we're discounting the price, and it doesn't have any caps. It's not like, oh, you get 10 visits and that's all. Like if you use 2 and your elderly parent needs 50 medical appointments or 50 medical things, we will work for that. If they need to get a walker, then we'll work with your insurance and make sure they have a walker. So we do all of those different things. And earlier you asked if they can have multiple accounts. As long as we have the consent of everybody involved, then yes, they can have access to their different family members and anybody else. We also do group calls if an elderly parent goes to the doctor and They want to debrief the conversation or they want to have the education side, we have the ability to add their son, their daughter, whoever on the call, and make sure that everybody's on the same page.
Super. Thank you so much, Marley.
Yeah.
And how do people find out more about you?
Yeah, so people can visit our website, www.medcompanion.com, or they can follow us on Instagram. We normally have free resources that we hand out, a lot of like patient education and handouts at medcompanion.co.
Fantastic. Thank you so much.
Yeah, thank you.